Thank you for having me, and thank you to Advocates for Youth, the CDC, Congresswoman Lee, for having this event. As a gay man, as an individual that's HIV positive, and as a physician who's devoted my life to sort of this pursuit of care and prevention of HIV among our nation's youth, I think this is a watershed moment, hopefully, and I'm really proud to be part of this. You're gonna have to bear with me because you're about to be something that's seldom seen, which is a physician standing on a podium trying to give a talk without PowerPoint slides. So I'm gonna try to do it, and you can sort of bear with me. But 30 plus years into this epidemic, it's a 30 plus year where we've seen some of the most amazing, sustained public health responses to an epidemic in comparison to any other ailment ever known in this world. We've seen some of the most amazing advances with regards to medical treatments, changing what was an almost certain life sentence, a death sentence, to now it can be a chronic illness. But yet it remains 30 years where a vaccine or a cure, functional or otherwise, remains an elusive goal. And in those 30 years, all too often adolescents or young people have remained caught sort of in between two worlds that have very organized political strategies and infrastructure, and that's a pediatric world and an adult world. And all too often adolescents get stuck in between those two worlds and don't get called to the table. And I'm proud to be part of Advocates for Youth because they see youth as the appropriate vehicle for change here that they are. So I'm going to focus my thoughts today around those themes. One is around giving sort of a face to the young people I see. The other is talking about missed opportunities, and I'll challenge my colleague at the CDC a little bit, but with a great deal of sort of respect. And the last is, I swear, and the last, I promise, and the last is to talk a little bit about stigma, because why are we here today? Why are we here talking about this disease? Because HIV is unlike any other disease in this world. If you have cancer, you have sickle cell disease, you've got cystic fibrosis, you've got any other disease known to man, you can count on. Everyone in this room can sit back and count on the love and support and help of every member of their family, of their work community, of their social networks. They will all rally and support you. That is fundamentally untrue when you're talking about an HIV diagnosis. And if we don't sort of embrace that thought and attack that stigma head on, we stand no chance in getting to sort of an HIV or AIDS-free generation. But my thoughts about the young people, I mean, I see those slides, and I'm guilty of sort of producing those slides. I do a great deal of sort of HIV surveillance research and prevention research, but I sometimes get horrified by those slides because it tends to depict young people from what I call this sort of spectrum of dysfunction, right? So you can't talk about HIV positive youth or gay youth or transgender youth without having to talk about HIV or STDs or homelessness or drug abuse. And yet, when I think about those things, that in no way captures the positive image that I have of the young people that I see every day in my clinical practice. I mean, these are not a sort of pathetic group of like STI-infected, drug-using mopes. I mean, these young people are active. They're strong, they're proud, they're changing the world in ways that generations before us have never even begun to think was possible. But they still need our help, right? They need our help as teachers, as family members, as role models. I mean, all too often gay youth in this world don't have available role models in their everyday lives or experiences, and they need them. They need us to sort of change people's minds. They need us to change antiquated and outdated policies with regard to HIV, and they basically need us to help change the world. They're going to do it, but it would be much easier if they have our help doing so. That takes me to sort of missed opportunities. I would argue that we should have known that this epidemic was coming 20 years ago. And we didn't know it was coming because we didn't collect good data. And if you looked at the slides from the CDC from 6 years ago, it was from 30 states, not 46 states. And we collected crappy data. And that crappy data led us down paths that we should have been led down. We should have known that young gay men in this country were at high risk of acquiring this disease and needed our help. And we as the gay community, we as the public health community, we as a nation have failed this generation of young gay men, and we should have known better. The data was there, we just didn't look for it. And we didn't do it with accurate methodology, and in some ways, Some of the states, my own included, Illinois, California, New York, we thought we were protecting people in our states by not reporting. The CDC was asking us to report, and we chose not to because we were trying to protect individual freedoms, and we had good reasons for having those fears. But in hindsight, what we didn't see was we could have seen this epidemic coming in these young men. It's appalling to me, again, as a doctor, as someone who's HIV positive, that 30 plus years into this epidemic, there is not a single behavioral intervention that has been tested, published, proven to be effective in young gay men. I mean, think about that. That's just outrageous. So there are so many missed opportunities, and again, I think the CDC should be applauded. I think particularly since 2005, 2006, they have been incredibly aggressive at seeing the data as it comes in and translating it into funding opportunities at the community level and at the national level. But these things should have been seen long ago, and they weren't, and they were sort of missed opportunities. I also think we need new business models in terms of, we keep applying to the same places to get money that's more limited and more limited. If I have to write one more grant, I'm gonna shoot myself in the head. Because I write these grants and I spend weeks of my life, and then I say a little prayer, I light a candle, and I hope I'm gonna get, well, we have bad business models when it comes to HIV prevention. We need to think creatively about new business models, not just with government agencies, with private partners. And that leads us to the next point, which is stigma. Why don't we have private partners in this game? Because this stigma that's associated with HIV. We can't talk about it openly the way we could about cancer or breast cancer or epilepsy, but we should be able to. Because again, if you go back to the fundamental issue that HIV is different than any other disease, think about it. Think about another disease where you would not be able to sort of count on the love and support of your family and friends if you had it. There isn't one out there. It's the fundamental distinction that sort of makes HIV different. So in closing, I really just wanted to give us one last thought, which is if we leave here today, and I don't see any of you back until next year for National HIV/AIDS Awareness Day, we have failed, okay? Because HIV Awareness Day cannot take the place of actual youth HIV/AIDS awareness. So all that's out there, that's my call to you all, is to take this day and to move it from just a day to a movement. This needs to be a movement that starts from this room and spreads across the country. Because without it, we stand no chance of doing what we need to do to make the world a better place for today's youth. So with that, I just want to say thank you.